In this video tutorial, I'm going to walk through how to discharge a patient in the Epic discharge process. So you're going to go to the disposition section like you normally would to place a clinical impression, and you put in your clinical impression as you normally would. Then going down, if I want to give the patient a prescription, you go to the ED orders and RX section. There it will also have listed the patient's previous medications that they're on if it's in the system. You're going to click on New Order. That is going to open up a new window over here on the right side, and that is how you put in your prescriptions. So if I want to send this patient home with some ibuprofen, just type it in, and I'm going to do some 600 milligram tablets, and it has an auto selection here. So this says 1 tablet every 6 hours as needed for pain with a dispo amount of 30. If I want to change this at all, I simply click it. It opens it for editing. So let's say instead I want to do just 15 tablets. Type that here. The class will be defaulted to normal, which means that it will be e-prescribed when possible. At the bottom here, you can see that they have a pharmacy in the system, and once you press the sign button here, the prescription will automatically go to the pharmacy listed. So when you're done adding all your prescriptions, you're going to press sign. If you want to add a narcotic prescription, you can do that as well, and that will automatically be printed. So the default here is 12 tablets. And if you decide that you're going to be prescribing this a lot, you can also press this star to make it your favorite. So when I'm done, I'm going to press sign. Ibuprofen is going to be sent directly to the patient's pharmacy. The hydrocodone or Norco will print out in the printer. Then I'm going to go to the next section, the instructions. Based on your clinical impression, there will be some auto-populated instructions. So you can just click whichever ones you want to add. If there's another one that you want to add, you can always search for it in the search parameters, and it'll show you multiple attachments that you can add. So you can select any of these. You can add that to the attachments. Under this attached instruction section, it'll give you a listing of the things that are attached. Patient instructions is a section similar to the current special instructions in Discharge 123, where you can provide the patient with any additional or extra information. Next is the follow-up. If the patient has a primary care physician in the system, they will be listed here, and you can simply select when you want them to follow up, and that will populate on their discharge instructions. If we want to refer them to another provider, you can press other lookup if we know that they're a HOAG provider, and because this person has an ankle fracture, I will refer them to orthopedics, and that will be put in there. And if you know that you're going to be referring someone to this physician frequently, you can also add a star there so that that can be easily found in the future. And finally, you're going to press the discharge button at the end, and that is it.